Hi. I know everyone has woken up one morning or maybe at night and they felt, oh, my head is hurting, it's killing me, and you wondered, how am I going to go to work or I'm going to go to school or whatever. And you felt sick to your stomach, you feel like throwing up, your muscles hurted, and you just felt bad. And most likely it was a cold or it was the flu or something, but these are also symptoms of polio. A lot of people here in the United States that's younger might not remember what polio is. But polio is a highly contagious viral infection, and it can cause paralysis of your arms and your legs and of your breathing. It can disable you. Some of the ways that you will get polio is through someone who has polio, through their feces, or through contaminated water or contaminated food is some of the ways that you can get polio. Some of the people that are more likely to get polio is small children or pregnant women or anyone who has an immune system that is low, such as if you have HIV or some other disease that causes your immune system to be lower than normal. And like I said earlier, a lot of times you just feel bad. Some people, they get polio and they feel bad and they make a full recovery. Some people aren't as lucky. There are 3 different types of polio, but today I will be speaking about spinal polio, which the virus affects the nerves in your spinal cord. And when it does that, it causes paralysis of your arms and your legs, and it causes breathing problems and sometimes even problems swallowing. There is currently no cure for polio. All they do is give you treatments. And the treatments can include painkillers if you have pain, or muscle relaxers if you have muscle spasms, ventilators, oxygen machines if you have trouble breathing, because mainly the treatment is just to make that person feel comfortable, because there's nothing that they can do about it. Millions of people have been disabled because of polio. There are ways to prevent polio, which include the vaccination that most of us in the United States get from birth to 6 years old. And in other countries, they get vaccinated also, but usually they don't use a shot. They usually do the oral vaccination. Most countries usually use that because it is cheaper, and also it's as easy to administer to a large amount of people. So that's what they usually get. The only problem is with the oral vaccination, there is a chance that you get at the polio virus in your body, and it can cause the polio that causes paralysis of your arms and your legs. So mainly the treatment now is just to prevent it with the vaccinations. If that's not available and you do get polio, then it's normally just to make you comfortable and to tell you to have exercise, because that helps moderate exercise, and also to have a proper diet and keep your weight under control, not to stress your body more than what it is. So these are a few things about polio. I hope you've learned something. This is a video that's really dear to my heart, because my mom had polio when she was a child. She got it here in the United States in the 1950s, because it was really an epidemic then. And that was right before they came out with the vaccination that we get now. And she now suffers from post-polio syndrome, which is if you don't make a full recovery and you get spinal polio. That's what they call it, because you no longer have that virus in your body, which makes you feel sick, but you still have the effects of polio, because you can be paralyzed in your arms or your legs, or you still have muscle weakness. So I hope you enjoyed this video, and I hope you learned something. And like I said, this is still a big issue in Nigeria, Afghanistan, and India. So please be informed. Thank you for listening.